that, former President Joe Biden has been diagnosed with an aggressive form of metastatic prostate cancer. His personal office releasing a statement saying the following. Last week, President Joe Biden was seen for a new finding of prostate nodule after experiencing increasing urinary symptoms. On Friday, he was diagnosed with prostate cancer, characterized by a Gleason score of 9, grade group 5, with metastasis to the bone. While this represents a more aggressive form of the disease, the cancer appears to be hormone sensitive, which allows for effective management.
Dr. Randall Lee from Fox Chase Cancer Center joins us now. Dr. Lee, thank you so much for joining us on this horrible news moment. Help us understand this diagnosis and the treatment that he will receive.
Thanks for having me, Todd and Carly. I think before we dive into it, a little bit about prostate cancer. It is the #1 cancer that is affected by men in the United States. We estimate about 300,000 new cases every year. There's different types of prostate cancer that are out there. President Biden just happened to have, unfortunately, be diagnosed with a rare and aggressive form of it. And how we grade prostate cancer is based on this Gleason scoring system, which we have heard about, that everyone has heard about. And that is essentially how abnormal do these cells look like under the microscope. And just so we know that this Gleason score, the highest you can get is 10. And President Biden, Gleason score was a 9 out of 10 on that. And we know that his prostate cancer has metastasized, meaning that it has left his prostate and has spread to his bones. Without knowing the nuanced details of his diagnosis in terms of how many metastases there are, how much symptoms he's having, we can say that the mainstay of treatment is hormone therapy, hormone therapy to reduce his testosterone levels.
Considering the high level of medical care available to him when he's president, he basically gets the CEO package, that I like to refer to it, almost on steroids, because you're the leader of the free world. You are constantly under medical supervision. Are you surprised that this wasn't found sooner, or could this type of cancer be that aggressive that it really could have presented itself literally in the 4 months since he left office?
I think you bring up a great point, and it's something that we all wonder. But, the reason why I call a diagnosis like this rare is because of how strict the screening criteria is. We're screening patients, every 2 to 4 years. I will say that the AUA, which is the American Urologic Association, discusses, moving forward with screening recommendations past the age of 70. That it's a patient and physician discussion. I'm not, can't speculate as to what the discussions were at that point, but, it's definitely possible with the type of prostate cancer that he has.
Dr. Lee, could he ever be cured, or is it past that point?
That's a great question. At this point, when we say that the prostate cancer has metastasized out of his prostate, stage 4, it is not curable at this point. But there's been such advances in advanced prostate cancer and metastatic prostate cancer to really reduce the effects of testosterone, that the survival in patients like President Biden, like I said, can't speculate without his full medical details, but patients very similar to President Biden have lived on for many years after initiating their treatments.
We really appreciate your insight on this. I think we all learned a lot more about prostate cancer over the last 24 hours, and you certainly helped us.
And we're praying for the former president as well.
Dr. Randall Lee, thank you, sir.
Thank you so much.